CEN Exam tips. Question 1. Which of the following is a priority intervention for a patient with priapism? Option A. Administer pain medication. Option B. Apply ice to the genital area. Option C. Prepare for surgical intervention. Option D. Administer oxygen. The correct answer is option C. Prepare for surgical intervention. Priapism is a prolonged erection lasting more than 4 hours, which can lead to ischemic injury and permanent erectile dysfunction if not treated promptly. The priority is to prepare for interventions such as aspiration, irrigation, or injection of sympathomimetic agents. Pain management, A, and ice, B, may be used but are not the priority. Oxygen, D, is not the primary intervention. Question 2. A patient is bitten by a venomous snake. What is the priority nursing action? Option A. Apply a tourniquet above the bite. Option B. Immobilize the affected limb. Option C. Administer antivenom immediately. Option D. Incise and suction the wound. The correct answer is option B. Immobilize the affected limb. Immobilizing the affected limb and keeping it at or below heart level helps reduce venom spread. Tourniquets, A, are contraindicated as they can cause ischemia and tissue necrosis. Antivenom, C, is administered after assessment and only for systemic toxicity. Incision and suction, D, are no longer recommended and can cause further tissue damage. Question 3. A patient is brought in with suspected carbon monoxide poisoning. What is the most important diagnostic finding? Option A. Carboxyhemoglobin level. Option B. ABG with POW2. Option C. Methemoglobin level. Option D. White blood cell count. The correct answer is option A. Carboxyhemoglobin level. Carboxyhemoglobin, COHB, level is diagnostic for carbon monoxide poisoning. ABG POW2, B, may be normal despite severe hypoxia because co-binds to hemoglobin. Methemoglobin, C, is seen with other toxic exposures. WBC, D, is nonspecific. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A patient presents with severe right upper quadrant pain radiating to the right shoulder, nausea, and vomiting. The nurse anticipates a diagnosis of Option A. Acute pancreatitis. Option B. Acute cholecystitis. Option C. Peptic ulcer disease. Option D. Gastritis. The correct answer is option B. Acute cholecystitis. The classic presentation of acute cholecystitis is severe right upper quadrant pain radiating to the right shoulder or back, Care's sign, along with nausea and vomiting. Acute pancreatitis, A, pain is epigastric and radiates to the back. Peptic ulcer disease, C, is epigastric pain. Gastritis, D, is epigastric burning or pain. Question 5. A patient presents with heat stroke. What is the priority nursing intervention? Option A. Administer antipyretics. Option B. Rapid cooling with cold water immersion. Option C. Administer 4 fluids. Option D. Obtain a core temperature. The correct answer is option B. Rapid cooling with cold water immersion. Heat stroke is a life-threatening emergency requiring rapid cooling. Cold water immersion is the most effective method. Antipyretics, A, are not effective for heat stroke, as the elevated temperature is from environmental exposure, not a reset hypothalamic set point. 4 fluids, C, are important but cooling is the priority. Obtaining core temperature, D, is important but should not delay cooling. Question 6. A patient presents with coffee minus ground emesis and melena. What is the priority nursing action? Option A. Administer 4 fluids. Option B. Insert a nasogastric tube. Option C. Prepare for blood transfusion. Option D. Assess airway and breathing. The correct answer is option D. Assess airway and breathing. The ABCs take priority. Coffee minus ground emesis and melena indicate an upper GI bleed. The patient is at risk for aspiration and hypovolemic shock. Airway assessment and breathing are the first steps. For fluids, A, blood transfusion, C, and ing tube insertion, B, are important but secondary to airway assessment. Question 7. A patient has presented to the ED with a complaint of chest pain. Which of the following represents an appropriate delegation of tasks to a nursing assistant? Option A, perform a 12-lead ECG. Option B, obtain vital signs. Option C, administer aspirin. Option D, assess the chest pain. The correct answer is option B, obtain vital signs. Obtaining vital signs is within the scope of practice for a nursing assistant and is appropriate for delegation. Performing an ECG, A, may be delegated in some states but is often a nursing responsibility. Administering aspirin, C, is a medication and cannot be delegated to a nursing assistant. Assessment, D, cannot be delegated. Question 8. An epidural hematoma is most commonly associated with which mechanism of injury? Option A, striking the head on a hard surface. Option B, rapid deceleration injury. Option C, injury to the temporal bone with laceration of the middle meningeal artery. Option D, acceleration minus deceleration injury causing shearing forces. The correct answer is option C, injury to the temporal bone with laceration of the middle meningeal artery. Epidural hematoma is typically caused by a blow to the temporal area of the skull, lacerating the middle meningeal artery. This results in rapid accumulation of arterial blood. Option A is too general. Option B describes diffuse axonal injury. Option D describes subdural hematoma. Are you looking for CEN Exam actual questions? Visit our website pokerexams.com to access CEN Exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN Exam answer key today. Question 9. A patient with opioid use disorder presents with suspected opioid overdose. Which medication should the nurse anticipate administering? Option A, naloxone. Option B, flumazenil. Option C, naltrexone. Option D, methadone. The correct answer is option A, naloxone. Naloxone, Narcan, is a pure opioid antagonist that reverses the respiratory depression and sedation of opioid overdose. Flumazenil, B, is for benzodiazepine reversal. Naltrexone, C, is for maintenance therapy. Methadone, D, is a long-acting opioid. Question 10. A patient with a history of DVT presents with sudden onset of chest pain and dyspnea. What is the priority nursing action? Option A, administer oxygen. Option B, obtain a 12-lead ECG. Option C, prepare for CT angiography. Option D, administer heparin. The correct answer is option A, administer oxygen. The ABCs are the priority. Administering oxygen to treat hypoxemia is the first step. ECG, B, is used to rule out ME but is secondary. CT angiography, C, is diagnostic but not the priority. Heparin, D, is treatment but follows oxygen and diagnosis. Question 11. Which of the following is the earliest sign of cardiac tamponade? Option A, muffled heart sounds. Option B, JVD. Option C, pulsus paradocus. Option D, hypotension. The correct answer is option A, muffled heart sounds. The classic Beck's triad includes muffled heart sounds, JVD, and hypotension. Muffled heart sounds are often the earliest sign because fluid accumulating in the pericardial space dampens the audible heart sounds. JVD, B, occurs as right heart filling is impaired. Pulsus paradocus, C, is a later finding. Hypotension, D, is a late sign indicating severe hemodynamic compromise. Question 12. A patient with a dog bite to the hand presents 48 hours later with redness, swelling, and purulent discharge. What is the most likely causative organism? Option A, Staphylococcus aureus. Option B, Pasteurella multocida. Option C, Streptococcus pyogenes. Option D, Bicnella corrodens. The correct answer is option B, Pasteurella multocida. Pasteurella multocida is the most common organism isolated from dog and cat bite wounds. It typically causes infection that appears within 24-48 hours with purulent drainage. Staphylococcus aureus, A, and Streptococcus pyogenes, C, are also common but less specific to animal bites. Achnella corrodens, D, is associated with human bites. Question 13. A patient with heart failure presents with acute pulmonary edema. The nurse anticipates which initial medication? Option A, for furosemide. Option B, for morphine sulfate. Option C, for nitroglycerin. Option D, for dobutamine. The correct answer is option C, for nitroglycerin. For acute pulmonary edema, for nitroglycerin is often the first line medication as it causes venous and arterial vasodilation, reducing preload and afterload, and quickly relieving symptoms. Furosemide, A, is used for diuresis but takes longer to work. Morphine, B, is used cautiously and is not typically first line. Dobutamine, D, is for cardiogenic shock with low cardiac output. Question 14. A patient is brought in with a nail gun injury to the chest. What is the priority nursing action? Option A, remove the nail. Option B, apply pressure to the wound. Option C, obtain a chest X-ray. Option D, assess for pneumothorax. The correct answer is option D, assess for pneumothorax. A nail gun injury to the chest can cause pneumothorax, hemothorax, or cardiac injury. The priority is to assess the airway and breathing. The nail should not be removed, A, as it may be tamponading a bleeding vessel. Pressure, B, may be applied but the priority is assessment. Chest X-ray, C, will help determine injury but follows assessment. Question 15. A patient presents with acute urinary retention. The nurse anticipates the need for? Option A, Foley catheter insertion. Option B, straight catheterization. Option C, condom catheter. Option D, suprapubic catheter insertion. The correct answer is option A, Foley catheter insertion. For acute urinary retention, insertion of a Foley catheter provides continuous drainage and allows monitoring of urine output. Straight catheterization, B, may be used, but Foley is preferred to prevent repeated catheterizations. Condom catheters, C, are for incontinence, not retention. Suprapubic catheter, D, is used when urethral catheterization is not possible. Question 16. A patient presents with a complaint of severe headache and photophobia. The patient has a temperature of 101 degrees Fahrenheit and nuchal rigidity. Which triage category is most appropriate? Option A, ESI 1. Option B, ESI 2. Option C, ESI 3. Option D, ESI 4. The correct answer is option B, ESI 2. A patient with fever, nuchal rigidity, and photophobia is at high risk for meningitis and requires rapid assessment, ESI 2. The patient is not unstable enough for ESI 1A, but needs to be seen quickly. Question 17. The nurse is caring for a patient who has been diagnosed with an advanced end-stage cancer. The medical team has suggested palliative care and hospice. Which of the following statements would be appropriate for the nurse to make when explaining the suggestion to the patient's family? Option A. Palliative care begins with the initial diagnosis and continues through the end of life. Option B. The patient cannot change their end-of-life decisions once enrolled in hospice. Option C. There is an important legal distinction between withholding care and withdrawing care. Option D. A living will names a person to make medical decisions if the patient is unable to do so. The correct answer is option A. Palliative care begins with the initial diagnosis and continues through the end of life. Palliative care is appropriate at any stage of a serious illness, starting at diagnosis, and can be provided alongside curative treatment. It is not limited to end of life. Hospice is one type of palliative care for end of life. Patients can leave hospice at any time. B. Withholding and withdrawing care, C, are not what is being explained. A living will, D, is a legal document specifying treatment wishes, while a healthcare proxy names a decision-maker. Question 18. A patient with cirrhosis presents with hematemesis. What is the most likely source of bleeding? Option A, peptic ulcer. Option B, esophageal varices. Option C, gastritis. Option D, a Mallory-Weiss tear. The correct answer is option B, esophageal varices. Patients with cirrhosis develop portal hypertension, leading to esophageal varices. These are fragile and prone to bleeding, causing hematmesis. While peptic ulcers, A, gastritis, C, and Mallory-Weiss tears, D, can also cause upper GI bleeding, esophageal varices are the most likely source in a patient with cirrhosis. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A patient is diagnosed with bacterial meningitis. The nurse anticipates the following finding on physical examination. Option A, positive Kernig's sign. Option B, positive Hohmann's sign. Option C, positive Brzezinski's sign. Option D, both A and C. The correct answer is option D, both A and C. Kernig's sign, resistance to passive leg extension with the hip flexed, and Brzezinski's sign, involuntary hip flexion with passive neck flexion, are classic signs of meningeal irritation in bacterial meningitis. Both may be present. Hohmann's sign, B, is associated with deep vein thrombosis. Question 20. A patient with Crohn's disease is at increased risk for which complication? Option A, toxic megacolon. Option B, intestinal obstruction. Option C, perforation. Option D, fistula formation. The correct answer is option D, fistula formation. Crohn's disease is a transmural inflammatory process that often leads to fistula formation between bowel loops, skin, or other organs. Toxic megacolon, A, and perforation, C, are more common in ulcerative colitis. Intestinal obstruction, B, can occur in both, but fistula is more specific to Crohn's. Question 21. A patient presents with organophosphate poisoning. Which symptoms would the nurse expect? Option A, pinpoint pupils, bradycardia, excessive salivation. Option B, dilated pupils, tachycardia, dry skin. Option C, constricted pupils, tachycardia, dry mouth. Option D, pinpoint pupils, hypertension, excessive salivation. The correct answer is option A, pinpoint pupils, bradycardia, excessive salivation. Organophosphate poisoning causes cholinergic crisis with muscarinic effects, meiosis, pinpoint pupils, bradycardia, salivation, lacrimation, urination, defecation, and bronchospasm. Dilated pupils, B, is seen with anticholinergic poisoning. Dry mouth, C, is seen with anticholinergic poisoning. Hypertension, D, is less characteristic. Question 22. A patient presents with stridor and drooling. What is the priority nursing action? Option A, assess the airway and prepare for possible intubation. Option B, obtain a lateral neck X-ray. Option C, administer nebulized epinephrine. Option D, administer 4 antibiotics. The correct answer is option A, assess the airway and prepare for possible intubation. Stridor with drooling in an adult suggests epiglottitis, a life-threatening airway emergency. The priority is to secure the airway. The patient should not be agitated or have a throat examination. Lateral neck X-rays, B, may delay care. Nebulized epinephrine, C, may be used for croup but is not appropriate for adult epiglottitis. Antibiotics, D, are important but secondary to airway management. Question 23. A patient with a known history of aortic stenosis presents with syncope. Which medication should the nurse avoid administering? Option A, 4-normal saline. Option B, 4-nitroglycerin. Option C, 4-morphine. Option D, 4-oxygen. The correct answer is option B, 4-nitroglycerin. Patients with aortic stenosis depend on preload to maintain cardiac output through the narrowed valve. Nitroglycerin reduces preload and can cause severe hypotension and cardiovascular collapse in these patients. 4 fluids, A, are appropriate to maintain preload. Morphine, C, should be used cautiously. Oxygen, D, is safe but not the primary concern. Question 24. Which symptom is most characteristic of a subarachnoid hemorrhage? Option A, sudden, severe thunderclap headache. Option B, gradual onset of confusion. Option C, focal weakness on one side. Option D, loss of consciousness without headache. The correct answer is option A. Sudden, severe thunderclap headache. Subarachnoid hemorrhage classically presents with a sudden, explosive thunderclap headache described as the worst headache of the patient's life. Focal weakness, C, is more common in ischemic stroke. Gradual confusion, B, is less characteristic. Loss of consciousness without headache, D, is not typical. Question 25. A patient presents with agitation, confusion, and is hyperthermic after ingesting a street drug. The patient's pupils are dilated, skin is dry, and the patient is tachycardic. What is the most likely drug involved? Option A, cocaine. Option B, methamphetamine. Option C, anticholinergic drug, example PCP. Option D, ecstasy. The correct answer is option C, anticholinergic drug, example PCP. The anticholinergic toxidrome is characterized by red as a beet, dry as a bone, hot as a hare, blind as a bat, mad as a hatter, flushed skin, dry skin, hyperthermia, mydriasis, dilated pupils, and delirium. Cocaine, A, and methamphetamine, B, cause tachycardia but also diaphoresis and constricted or dilated pupils depending on the stage. Ecstasy, D, can cause similar symptoms but typically also includes diaphoresis.